Thank you for joining us for Arkansas Arts Advocacy Day. In addition to Advocacy Day, Arkansans for the Arts reaches out across the state through events like our town hall meetings. We do these in every district, and this year, because of COVID-19, we had to do a couple of them online. The following presentation is from our District 2 and 3 virtual town hall meeting. Dr. Brooke Laurent is an Arkansans for the Arts board member. She presented on the intersection of arts and health. Dr. Laurent is the chair of the Department of Clinical Medicine at the New York Institute of Technology's College of Osteopathic Medicine at Arkansas State University. She is also the founding executive director of the Delta Population Health Institute, which is the community engagement arm of the college. Thank you for watching.
Thank you so much, ERIN, and welcome to everyone. It's a pleasure to be with you tonight. I'm very excited. I'm one of the newest board members. And I'm really just a pleasure and an honor to be with such a cadre of amazing Arkansans. I'm a native New Jerseyan, and I moved to Arkansas, in 2016. So I'm coming upon my, that 4 years now, and really just being part of this organization has been really incredible, encouraging, and inspiring. So I'm very excited to be a part of this incredible group. I just want to check. ERIN, do you only see my screen here? Or you see a block of black? I just want to make sure. Do you see the entire screen? My PowerPoint?
I believe we see the entire screen. I do see all of your text on the right and then the background as well.
Okay, great, wonderful. Thank you so much. So initially, I'll go very quickly as I can. When ERIN wanted to bring a health perspective, I was like, well, maybe we can talk about COVID too and all of this. And I think I was a bit ambitious, and I'm like, really can't cover that in about 7 or 8 minutes. So I'm going to focus on the intersection of health and the arts. I will be talking about it at the end, but I'll be approaching that more so from a perspective of what opportunities that we have given this new landscape. Some of you may be familiar with these intersections, so this would be just a brief review and overview. So basically my presentation today will be based on the white paper that was commissioned by the National Organization for the Arts in Health, called Arts, Health, and Well-Being in America, as a national organization for arts and health. So this organization, which is an acronym, is called NOAA. It provides transformational leadership to bring the field of arts and health together and to move the field forward. The mission of NOAA is to unite, advance, and to serve the field of arts and health. And its vision is arts and health as an integral component to health and well-being. And so I found that this document was really a great holistic approach in the intersection. And what I want to talk about in this commission white paper is what their recommendations were for each component, where the intersections of arts and health is. And also they give some concrete policy opportunities that states and on a federal level can act upon to advance health and the arts. And I'll be highlighting some of that throughout this presentation. I'll start with this really good and powerful quote from our 19th Surgeon General of the United States, Dr. Vivek Murthy. He said, "Within the arts lies a powerful but largely untapped force for healing. The arts and science are two sides of the same coin, which is a shared humanity, and our ability to live fulfilling, healthy lives depend on bringing these two forces together." And I think this is such a powerful comment, especially in the context of what we're experiencing today. First, I want to talk about, in general, is an umbrella topic of arts and health, is that it is a maturing field, and it's dedicating to using the power of arts to enhance health and well-being in very diverse institutions and diverse community contexts. And it is well known that engaging in these creative experiences is vital to human health and well-being, and bridging life experiences that divide people in society and helping them bring together understanding the human condition. Again, I think those words truly resonate in what we're experiencing in this context at this time. And so I'm going to be highlighting some arts and humanities that are seen in the training of healthcare professionals, performing visual and literary arts in patient care for the caregiver and for community populations. Arts is being used as a community response to crisis and trauma. And then lastly, health and wellness lens in the design of space or built environment. We see that art supports health in enhancing the healthcare experience as it involves patient clinical outcomes and enhancing the healthcare environment for their family members and caregivers. Secondly, we'll see an increasing healthcare focus on preventive health. Arts is being used to promote public health and population health, and arts can be implemented within a public health program, specifically when you're doing community engagement, needs assessment, health communication, and health promotion. And as you can see, there's a lot of power right now when it comes to health promotion and health communication. And if the wrong type of message is iterated within a community, it could be to the detriment of the community. So arts have a role and an opportunity here to get the right information out to keep the safe and wellness of the communities at the forefront of our minds. Thirdly, the arts are frequently used in community settings to support community well-being. And in this context, art can support healthy aging, treatment of chronic illnesses, recovery processes, community cohesion and reliance after a natural disaster or human-caused disaster, and the provision of healthcare for underserved populations. And lastly, you'll see arts and humanities increasingly being used to foster resiliency in medical professions, enhancing the medical student observation skills, emotional challenges in their profession, and provide outlets to relieve stress. And so I also would talk about the research that we see in arts, health, and well-being. And the article or the commissioned paper talk about what's being underscored here in their research goals, and which is to enhance the environment care for patients. They have research whose objectives are to improve outcomes, to reduce anxiety, pain, and length of stay of readmissions in hospitals, and increasing well-being overall, as I mentioned before. And then I will be talking about the advances and the advances of art in health, not only in the clinic or the hospital, also outside of it as well. So very briefly, you know, the medical model of healthcare once is really based on how to cure, focusing on a cure of disease, but it's evolving more into more of a humanistic model of care, where the patient's needs and satisfaction are becoming central to clinical services. Unfortunately, the infrastructure is needed to make this kind of healthcare change is not really in place. It certainly is not a common experience, and it's not accessible to all healthcare systems, but we have opportunities to make this art integrated in a holistic way to enhance the patient experience. And this example that I'm showing you here, there are many institutions such as the Harlem Hospital in New York, for example, was one of the 500 locations among public hospitals in New York that was a recipient of murals commissioned by the Work Progress Administration in 1935. And they've had a lot of restoration done since then, but this was one commission that was awarded to African Americans. I think the largest amount of money was given to African American to create this mural that you see along Fifth Avenue in Harlem. So a very interesting way and powerful way to get a community engaged, and also to build trust of health between the health entity and the community. And very quickly, I'm just talking about the specialists that are involved in healthcare environment. We need architects, art consultants, landscape architects, healthcare art administrators, interior designers, and professional artists. And we are seeing that healthcare executive leaders are increasingly recognizing how to integrate the arts and design in a healthcare facility. But we do need to have these people at the table to talk about how we can achieve these goals while maintaining regulatory requirements, safety guidelines, addressing infection control principles, you know, selecting visual arts and design that celebrates the location, the community, and the culture, you know, and how to use visual arts to help with wayfinding in a very complex facility. So some of the recommendation that NOAA has made about health in a healthcare environment is to create these standards of care and standards in training and credentialing of artists and art consultants in the healthcare setting. So having certificates and policy around those things, and creating elective courses in arts and healthcare design, visual arts and healthcare design, visual arts and healthcare setting. So they're making some very concrete examples of how we can get people more trained in this to meet this need. And then in arts and patient experiences, there are three broad categories that I'm going to go very quickly on: certified creative art therapists, expressive art therapists, and artists in healthcare. These are three brain types of broad categories that speaks not only to the environment, but the patient's experience. And so creative art therapists have six main organizations in dance therapy, music therapy, society group psychotherapy, National Association of Poetry Therapy, North American Drama Therapy. These are people who have had training. They have a scope of practice. They have a code of ethics. They have continuing education requirements, and this can be integrated in healthcare. Expressive art therapy does not have exact clear scope of practice, but it's an integration of all these types of arts in one setting to provide care. And they don't necessarily have a goal to promote a health outcome, so to speak, like a creative arts therapist, but expressive art therapist is there really to just enhance the experience as much as possible. And then you have some hospitals that have arts and health, and that basically is having an arts coordinator overseeing the entire vision of arts in a healthcare entity, where you have visiting artists, arts in residence, art collections, rotating art exhibits in a healthcare entity. And for the patient experience, you can have music, dance, movement, theater, visual arts, etc. So the recommendations that they have here for hospitals is to set up credentialing and certification for artistic competency, and creation and approval of scope of practice, again, and educational competencies and standards of practices needed to make this a concrete, integral part in health outcomes. And very lastly, I'm going to talk about arts and health science education as a family medicine doc. And experiencing humanities being integrated in education, and also as a medical educator. This is such a powerful tool that I use with my students in our medical school, one to build resiliency, but also to help them understand the patient experience and to evoke empathy. And it's such a very powerful tool. And so with the use of arts there, we can help increase empathy for healthcare providers and professionals, improve observational skills, how to treat people in various stages of their lives, care for healthcare professionals about mental and spiritual wellness, and how to build resiliency. One really cool thing before I leave off is that there's this relatively new term in the arena of humanities and medicine called graphic medicine. So it's the use of creation of comics and graphic novels used to be a resource for health professionals for reflecting and how to perceive different cultures in medicine and how to respond to that. And so you might want to look up this doctor. His name is Dr. Michael Green. He's out of Penn State. Out of his humanities department. And this is really a cool course that medical students can take to help not only understand the patient experiences, but they usually do comic to show how they're going through being a health professional and what they're experiencing. And the last thing I want to bring up, which will tie into COVID-19, is how can arts intersect with community health and well-being? Rapid expansion of fields in arts and community is expanding rapidly. And so the NOAA document talks about how the arts can come in alignment with the Healthy People 2020 goals in terms of attaining higher quality of life and longer lives free of preventable diseases, achieving health equity and eliminating disparities. Arts can definitely affect that, create social and physical environments, and promote quality of life. So very briefly, COVID-19, aside from the acute things that we need to deal with in the medical field right now, we're also looking at a kind of a third and fourth wave. And what we mean by that is, because there's delayed care for individuals and people may have fear of going into the hospital, we're concerned that there may be an increase of chronic care illnesses. And as you know, in the state of Arkansas, in the Delta, we already have the lowest in terms of ranking for health outcomes. And so we're going to see we're anticipating seeing an uptick in that, and decline in preventive care, vaccinations, prevention of diabetes, hypertension. We're also seeing an increased demand of mental health services as well, given what's going on. There's a concern that healthcare systems might fold. There are small clinics in rural areas that might be closing, and that will affect the accessibility and access of people to the healthcare providers. We also see increased use of telemedicine, and a lot of policies have been cleared out the way to help get people the care that they need, and opportunities to address upstream factors for health. And this is where really our arts community can really engage. If we want to address upstream factors, all these social determinants of health that affects health outcomes, education, built environment, addressing chronic stress, transportation, and all this type of these upstream factors that affect health outcomes, we have great opportunities for the arts arena to intersect there to really help achieve better health outcomes. And again, opportunities to address infrastructure and healthcare in our community health is here. I think people are seeing the interconnected of health in every sector. And so I believe our organization have an opportunity to inform that and to be integrated into those discussions.
Thank you for watching this presentation on the intersection of arts and health. It is because of our membership that we're able to bring content like this to you. I hope that you will visit our website, arkansasforthearts.org, and join today. Thank you for being a part of One Voice for the Arts in Arkansas.